G'day, I'm Tim Mann. I'm an Australian physiotherapist, a musculoskeletal physiotherapist and an accredited Mulligan concept teacher. Thank you for joining me today in this little introduction and demonstration of PIM, or Physiotherapy Instrument Mobilisation. First of all, I'd like to say that if you do not believe that manual therapy is an important part of physiotherapy in conjunction with exercise, posture, lifestyle management and education, then this video is not for you. If you do believe that manual therapy has a part in a comprehensive, holistic management of your patient, then I would like to explain to you the benefits of using this instrument here in some of your physiotherapy manual techniques. This instrument will get you good outcomes more efficiently, more safely and with less effort and less injury to you and your hands than any other form of manual therapy. So what is PIM? PIM is the application of carefully regulated forces very specifically to joints to obtain movement. Nothing more than that. So what are the benefits of it? It's quick. What would you rather do? 3 to 6 of those to loosen a stiff joint, or 3 lots of 20 of that to achieve the same result. So it's very effective and it's efficient. It will save you time. It's also very safe. The literature has very, very few instances of any kind of side effects or complications from manual therapy using an instrument, whereas there are significant reports of injury from manipulation, for example. This tool is well accepted by the patients. It minimises their discomfort because the treatment is over in a few seconds. So how do we use it as part of our manual therapy approach? Well, first of all, the patient must have a dominant articular problem. That means you have to exclude or previously deal with motor control issues, postural issues, neural issues such as neuropathic pain, central sensitization, and treat those as is appropriate. So, having excluded those things and establishing that the patient's problem is dominantly articular by a trial of snags, doing PIVMs, PAVM palpation, osteopathic type palpation, or whatever you use, if you have found that the problem is dominantly articular, this instrument has a role. So, for example, if a patient, such as this one here, presents with a painful right upper neck and they've got related headaches, for example, and you have tested to make sure that it's not dominantly postural or it's not dominantly motor control, for example, weak eccentric flexor muscles, and you have excluded neuropathic pain and neurological issues, and then you can be sure you are treating a joint. If you find, using your established knowledge and skills, that it is, for example, a stuck, closed joint, then you have choices as to how you mobilise it. You may do unilaterals, you may do PIVMs, if you have the skills and have indicated, you might perform a manipulation, or you could use this tool and apply it in an upslope direction along the facet plane and apply 3 to 6 mobilizations, and you will get the manual therapy result that you want to attain for your patient. You can follow up, of course, with specific exercise, and I would recommend the Mulligan self-snags as well. You may also need to add motor control to make sure that the results last. You can use the PIM not just on the cervical spine, all parts of the spine, the pelvic joints, and also all the extremity joints. For example, if someone has a problem, let's say with a stiff subtalar joint, and they're getting heel pain syndrome, and you've done your assessment and you've excluded everything else except a stiff subtalar joint, you can apply the mobilization. Not that it will move quite as much as that in a real life patient, but you get the idea. Okay, PIM is a useful tool. It would be an excellent addition to your skill set. We run courses on it, and if you'd like to click the link for further information, we would be happy to tell you more about it. Cheers.
Yeah, that was much better.
Practice makes perfect.